about a third of women around the world of childbearing age are deficient in iron. Yes, 1/3 of women. Why, as a plastic surgeon, am I even talking about iron levels? You can lose blood when we're operating, and if you don't have adequate supplies, if your hemoglobin is starting low, that can be a problem.
Behind the mask. The more you know, the better you look. Behind the mask.
Today, I want to be talking about iron, and specifically about iron deficiency and how that can lead to anemia. So before we get into iron, I want to give you a little bit of background on where iron is, what it's used for, and why it's so important. The little iron itself is part of a hemoglobin molecule. And then the red blood cell is made up of several hundred million molecules of hemoglobin. So that red blood cell is carrying around these millions and millions of hemoglobin molecules, each one of these hemoglobin molecules with 4 little molecules of iron in them. And the iron, as part of that molecule, is what's really responsible for binding the oxygen in the lungs, carrying that to the tissue, and then releasing that oxygen in the tissue. That's what's transporting oxygen in your body. That's why it's so critically important. Now, why do 1/3 of women have low iron stores in their body? Well, it's pretty simple. Number one, it can happen when people are pregnant because the baby, the fetus itself, is requiring iron to grow and develop. And two, from monthly menses, which is obviously a loss of blood, which is a loss of iron. And the third most common cause, although it's not as common as the other two, is people that are on vegetarian diet, sort of a strict vegetarian diet. What I do with all my patients is I measure a ferritin level. That's how we measure the iron level in your blood. You get a ferritin level check, just like a standard lab when you get your CBC and everything else. And so we measure the ferritin level. And that ferritin level should be in the normal range. If it's not, then we need to start supplementation with iron. This is not something that you can fix in a day or a week or even a month. It typically takes at least 3 months, and some people say 6 months, to increase and return your iron levels to normal. The best way to do it is to take it's an over-the-counter iron supplement called ferrous sulfate, and you take 325 milligrams of ferrous sulfate. That actually has 65 milligrams of iron in it, and that is ample amount of iron. You can take that once a day. They can cause nausea and they can cause constipation, and that can really prevent people from being compliant and taking it. It's okay if you actually take the 325 milligrams of ferrous sulfate every other day. Find something that will work for you so that at least you're taking it every other day. The other important thing to understand is that more iron is not necessarily better, and it can increase the side effect profile and not really doing you any benefit by taking more and more and more. Now, when you take iron, you want to take it alongside at the same time with some vitamin C. Just 500 milligrams of vitamin C once a day, taken at the same time as you take the iron, and it'll help convert that 65 milligrams of iron into a different configuration that will help your body absorb it. There's also some things that are important to avoid when you're taking iron, and not to take them at the same time. So those are things like calcium supplements. So it's not a good idea to take a calcium chewy at the same time as you take your iron, or to take your multivitamin that has calcium in it and take that at the same time as your iron. It's also not a good idea to wash your iron pill down with coffee or tea or milk or yogurt, because those again will decrease the amount of iron that your body is absorbing. It's not only important to take your iron supplementation before surgery, but it's also important for you to take your iron supplementation after surgery. When you go through liposuction, for example, you're going to also have a significant blood loss, and so you're still going to have to build up those iron stores after surgery. So even if you weren't deficient before surgery, you're going to have the blood loss, which is going to shed your body of that iron. Remember, those iron are bound to the little hemoglobin molecule that's in the blood, and you're going to lose that during surgery. So you're going to want to continue to take your iron and your vitamin C post-operatively as your body works to build up the iron stores again. The other thing to talk about is foods. There's two different types of iron in food. So there's an animal-based food, which is called a heme iron. Meat, chicken, fish, they're going to be high in the heme iron. It's the same iron that we have in our blood, and our body is able to absorb that iron much more easily than a non-heme iron, which is in the plant. Plants actually, legumes, nuts, lentils, some leafy greens, they're actually high in iron content. The difference is if you eat an animal protein, 100 grams of an animal protein, you're going to get a lot of iron. If you eat 100 grams of a plant-based iron source, you'll get the same 100 grams. The problem is you have to eat this much of the plant compared to a small amount of meat. And so the body prefers or more easily absorbs iron from an animal source, and that's where a strict vegetarian can end up with some, and not everyone, I'm not speaking about every vegetarian, but I'm just saying that they can be, particularly for long-standing strict vegetarians, they're at more risk of developing an iron deficiency anemia if they're not consuming a plant-based iron-rich diet as part of their vegetarian diet. The final thing, and a good way to actually get iron in your diet, is something called the lucky iron fish. And what you do is you just throw that into whatever you're cooking, rice, stews, soups, anything that you're cooking, and a couple little drops of some type of acid, either vinegar or lemon juice, and it will actually elute iron into your meal. It's not a ton, but it's like 6 or 8 milligrams, and which is a good amount. If you look at some of the cultures around the world, whether they know it or not, and those that are using and reusing heavy cast iron pans to prepare their food, they're actually getting some iron source from that food. Very important to understand the concept of iron deficiency anemia, because it is such a common problem. It's fairly easy to correct. I would say if you talk to your family doctor and your ferritin levels are normal, so that means your iron stores are normal, but you still have a low blood count, then it's important to go and get that evaluated. When you realize you're going to be having liposuction or a BBL, you always want to start off by taking iron, vitamin C, and folate, because those you can be deficient in iron or deficient in folate, and those are very common causes. So even if you don't know the cause of your anemia, it's safe to take those things, and they will solve a lot of the causes of anemia. So it's worthwhile doing that. So thank you very much. I appreciate you tuning in as always. If you have any questions about this, then leave a comment below. I'm happy to answer that. Or if you have an idea for another video or a question that you would like seeing made into a video, just leave a comment below. And also, please let me know where you're watching from. I love this, where I get shout outs from people from Singapore or Dubai or London or all over the world. And it's awesome. I love to hear where you're watching from. So leave a little comment where you're watching from if you've got a moment. Have a good evening, and thank you very much for watching.